Cerebral palsy was long thought to be both permanent and essentially untreatable. But at least for children, that view may be on its way out. Just as harnessing neuroplasticity is transforming how doctors approach brain injury in adults, Dr. Karen Pape is pioneering this science to help kids with cerebral palsy. She lays out her findings in a new book. It's called The Boy Who Could Run But Not Walk, Understanding Neuroplasticity in the Child's Brain. And Dr. Karen Pape joins us now here in our studios. Great to meet you.
Thank you. Nice to meet you.
We're
nice
going
to be
to
here.
run a little piece of video here as we consider the definition of cerebral palsy. Maybe you could help us with that, because I'm not sure everybody knows what it is.
Okay, well, cerebral palsy is caused by damage to a growing young brain, and it can be caused by disease or trauma or prematurity. This young lady actually had birth asphyxia. There's a shortage of oxygen at the time she was born. So you can see she walks very slowly and very unsteadily. She actually needs some help going along.
So it's not something you're born with. Something has to happen to you, and then you get it?
Some people are born with it in the sense that their brain is not developed normally in the uterus, but about 50% have some sort of perinatal problem around the time of birth. They're either born early or they're born with complications in a full-term pregnancy.
And how did you discover that this was going to be your mission in life?
Well, I was a neonatologist, so I was actually at the hospital for sick children taking care of babies in newborn intensive cares. And so all of the kiddies that were sick would come to us, particularly way back in the 70s when there weren't all the perinatal regional units. And I turned out to be the brain doc because I had done neuropsychology before I went into medicine, and I just like brains.
You just like brains.
I did.
Good.
And fortunately, all my colleagues liked lungs or nutrition or something else. So
Wasn't much competition.
I got to see all the ones with brains.
Gotcha. Let's do an excerpt from your book here in which you write, unlike the traditionalists, I think that much of the spasticity in cerebral palsy is a habit, a brain and body habit. As a habit, it can be replaced just as a wonky tennis serve or an errant golf swing can be changed. Let's get into this because this is pioneering work here. I want to have you tell us about somebody named Daniel, who's a boy, inspired the title of the book, and how he illustrates this concept of cerebral palsy being a habit.
Okay. Well, when I was a neonatologist, I was the brain expert, and I did ultrasound brain scans so you could actually look at the baby's brains. And Daniel had a big bleed in the right side of his brain as a newborn. And I thought, and was actually quite sure, that that would lead to a left hemiplegia, unlike the girl that you just saw.
Sorry, hemiplegia being?
That's, I'm just going to say,
okay.
It's a type of cerebral palsy that involves just one arm and leg, very much like an adult stroke. Really, they walk the same way. It's indistinguishable. So we started him in early treatment, and when he was about 3 or 4 years old, I discharged him from the follow-up clinic. And then 3 years later, I got a phone call from his mother. And she said, Daniel's playing soccer. And like a typical doctor at that time, I was young, I sort of rolled my eyeballs and said, sure he is. I didn't say it out loud, but I was thinking, over enthusiastic mother, kids with cerebral palsy do not play soccer.
Right.
So she picked that up in my tone of voice and attacked me. My parents and families get along with me pretty well. And said, no, he got in on the 4th tryout. And I said, okay, come and see me, because it just didn't make sense. So the hospital was going through one of its endless renovations. So I was in an old ward in my clinic, and I had an empty hallway. So I said, okay, Daniel, walk up and down. Because I wanted to prove to myself that he still had hemiplegia. So there he goes with a little limping gait, hand up like this, not moving, the other arm doing fine. And so I say, now run. And he took off like a bat out of hell. He just took off. And right at the end of the hallway, he did a perfect pivot turn on his right leg. And I said, well, that doesn't bother me. That's his good leg. But then he came and he did the exact same thing right in front of me. And guess what I said? I said out loud, to my endless embarrassment, you can't do that.
But apparently he can.
He did. I made him do it 3 or 4 times. Poor little kid was absolutely exhausted. But it stuck with me that this one pushy mom who really put her son through everything and got him involved in sports And yet, if you can run normally, and he was running normally, then your brain's normal because you walk and run with the same parts of the brain. So I knew about brains, and it just bugged me. And I have to say, it took me years to finally step back, because everybody said this is permanent, irreversible, and it gets worse as they get older. And yet he got better as he got older.
So how do you explain the fact that he could run, but he couldn't walk?
Well, you see, I think he learned to walk when his brain was damaged and when it was immature. He learned to run when his brain had recovered, and in this case, it had recovered completely because he was a competitive soccer player, and it was recovered, but was also more mature. But kids don't know the difference. So once I understood that it was a habit, I could find these children everywhere. I mean, they played.
Sorry, once you understood that the impaired walking was a habit.
And I started looking for their highest level of skill, then they're everywhere.
Norman Doidge, who's been on this program numerous times, and I know you know, wrote the book, The Brain That Changes Itself. And he says that you are, quote, rightly demanding that colleagues integrate the new science of brain plasticity into the treatment of children with CP. Why do you think there has been resistance to this approach in the past?
Well, it's not surprising. Change is difficult for everybody, and we know about it, but we tend to think that doctors aren't resistant to change, and that's just not true. And Norman was he changed the world for adults with stroke and adults with MS and Parkinson's disease with his first book, The Brain That Changes Itself. Because before that, neuroplasticity was known to neuroscientists, and it's been known to neuropsychologists since the 1940s. But in medical school, I was taught that human brains don't get better. And an awful lot of people my age who are now in control of medicine were taught the same thing. So it's the resistance to change, and it's silos of knowledge. So if I say baby brains can recover, I get arguments in my own field. But if I talk to pediatric neurosurgeons, they say, of course they do. We can take out half a brain and the baby can be normal. So it's just that medicine is no different from any other industry. And we all have challenges by information overload.
The name of the woman in the first clip that we showed was?
Christine.
Christine. We're going to show another one. This is Laura. Laura was a girl you helped back in the 1990s. So Sheldon, let's have a look at this clip, please.
Show us your stuff, Laura.
When Laura took her first steps without the walker and without her crutches, it was a feeling that is very difficult to describe. We were just thrilled, and just the look on her face, it just would tell it all. She was so proud of herself at the same time, and just to feel that independence and to know that she could do that, it was just, words can't describe. It was wonderful.
Words can't describe it. That must be a moment, to see that?
It really is.
What's that like?
Super, absolutely super. I mean, and as soon as I could start to look for what children can do instead of what they can't do well, it just changed it over. And if you stop and think about it, if you go to a tennis pro, I used to be a tennis player, you go out and for the first 10 minutes, they have you try out all the different shots and they see what you can do and what you can't do. And they don't immediately start working with your wonky serve. They perfect what you're already doing, okay? And it's just the difference between looking at what's wrong with somebody versus an athletic model, which is, what are your strengths? What's your best shot? How can we make your best shot more consistent? And that's the sort of treatments that we did.
Let's get a couple of technical things on the table here and figure those out, because you've looked at a few specific therapies that you've used to help kids with CP, and one of them, I gather, is called Emg Biofeedback.
That's right.
What is that?
It's a technique that's been around since the 1960s, very widely used in adult neuropsychology and stuff like that. Basically, you put electrodes on the skin, and it picks up the little tiny movements of the muscle. And it takes those movements and it shows it either as a light that changes from yellow to green, or a bar graph that moves up and down, so that when you tell a child who, say, for example, has difficulty lifting their wrist, and you say, lift your wrist, well, nothing much happens, but they see the lights going on. So you don't tell them to keep trying to lift their wrist, because they can't do that. Tell them to look at the graph and make that line go up And as they watch and watch and watch, the line goes up, and then it goes down, and then it goes up, and then it goes down. And then you say, look at your hand. And they go, like, what's happening?
So application for cerebral palsy is
Exactly
obvious.
that. It's showing them what their body can do outside of the habit.
You brought something with you. What's that? That's a wet vest?
This is another thing that I fell in love with in the 80s. This is a little wet vest, and it's made of neoprene. And when you put it on, it gives you neutral buoyancy. So in the water, in deep water, you can just hang out. You don't have to move. When you put a child who's got difficulty moving, or an adult, in this, they can jog. They can start to walk, and then they can start to jog in deep water.
In water.
In deep water, without the effects of gravity.
You want to, should we roll this thing here? Let's roll it, because we got video of this too. Here we go. Okay, take us
Filmed
through.
underwater with a wet vest flotation device, she is able to move both legs symmetrically through a full range of movement. This demonstrates that her brain is able to initiate a normal reciprocal gait pattern in the absence of gravity. Now that's Christine.
That's Christine, the first one we saw.
Yeah, who
Off the
could
top.
barely walk.
Who could bet? So, but she can in water, but she can't on land.
That's right, because the water takes away gravity. And there's a whole industry that's developed in cerebral palsy and adult spinal cord injury of using gravity-eliminated machines that would take a person and get them out of gravity and teach them how to walk. And, you know, it's a great industry. It costs $10,000 to $30,000 for a 3-week intensive, and you go off and you learn how to do this. But, you know, this little baby comes from an extra small all the way to an extra, extra large. And this one I bought for my granddaughter so she could have fun before she learned how to swim. It's at least 10 years old. They don't wear out.
How much are they?
Under $150.
You mentioned the word fun.
Yeah.
Is that a big part of it?
Fun. One of the things that we know from neuroplasticity research is that if you can make something engaging, fun for kids, engaging for adults, they do better. So if you have an adult stroke, for example, as Norman Deutsch talked about, just doing useless activities, trying to lift a pen or a stick from one side to the other, nothing much happens. But if you teach them that within a context like unloading your groceries and putting them up on a shelf, they'll happily do it because it's got a functional use.
Botox. I thought I knew what Botox was used for. Well, I do know what Botox is used for, but there's another.
No Botox.
There's another use apparently.
Well, Botox is approved for use in cerebral palsy because Christine, the child you saw, the adult you saw, has got a movement disorder and she's weak. Little Laura is tight, and that's a characteristic of CP. So if you have a CP hand, your hand tends to be fisted, the wrist comes down. These muscles are spastic and overactive, and these ones are weak and inhibited. So what Botox, I think it's revolutionary. You put Botox into these muscles and they relax. Then you mobilize the joint, and then you teach them with things like Emg Biofeedback how to actually activate it. When they try to activate it without the Botox, so you've got a hand like this and you say lift your wrist, they just, the spastic muscle just keeps, we call it a bully muscle. It just bullies the way through. So the Botox is just an incredible innovation.
Who figured that out?
I think one fellow down at Harry Webster at the New England Medical Center in Boston was the first one who fought to do a CP study.
Seems obvious on the face of it that if it's going to relax your forehead and make you look 10 years younger, it might have relevant applications for CP.
Yeah, everything's obvious after it's done.
After it's done, yes, after somebody else figures it out.
Exactly.
How old do kids need to be before they do the biofeedback or the wet vest, that kind of thing?
Well, this one they can start as infants because there's infant versions that they can swim with. Emg Biofeedback, I used to use it as an aha moment, just to prove to the child or to the parent that there was better brain functioning in there. And you could do that as early as 2. You could trick them into it. But basically, 4 to 5.
Do I infer that once those kinds of small victories happen, there is, I mean, it's a revelation to everybody, and then suddenly...
Well, it's an aha moment, so it gives you the motivation to do the work. Because changing a habit, I mean, have you tried to change your golf swing? It's a hard job.
If it's baked in, it's really tough to change it, isn't it?
That's right. And so that's one of the reasons why I think people have thought cerebral palsy is permanent and irreversible, because it just takes so long. And in many cases, I have to wait till the kids are teenagers to really get change.
Well, let me follow up on that, because if you didn't have some of these therapies when you were a little kid, so you had none of that, and now you're a teenager, you want to introduce it as a teenager, are your chances of success significantly less?
No. Actually, well, yes and no. If you've got very tight muscles, you may have some significant distortions of growth that need surgery, but for the vast majority of kids, puberty is just a second chance. They get about 40% more brain power. Parents always argue with me and say that teenagers become stupid, but actually they get more brain power as they go through puberty. So that's an advantage. They get sex hormones, they get growth hormone. They're sort of like an athlete on illegal drugs if you step in and do the type of athletic training that can change them.
Am I right that in the United States you can get Botox as early as age 2?
Yes.
How about here in Ontario?
I'm not sure. I don't think so.
You don't think so?
No.
How come?
That's a really controversial question. I think there's a lot of people who are still working on old-fashioned medicine. And just as there's resistance to change, there's resistance to moving. An awful lot. There's a wonderful, the randomized controlled trial is considered the gold standard in medicine. And there's a wonderful paper of a systematic review of systematic reviews of randomized controlled trials. And there's over 64 treatments that have been proven to work with cerebral palsy. And they're not available.
Why not?
It's new.
Well, it's new. Okay, but
And it's not paid for.
Well, okay, here we go.
Okay, the same people.
So is this OHIP or is this private insurance companies or what is it?
It's everybody.
It's everybody.
It's everybody. If your doctor doesn't advocate for you, then your insurance company won't pay for it. It's just one of the sad things of life. It's actually why I wrote this book. I've been teaching this for 20 or 30 years and getting fairly frustrated at times. But when I sit back and think about what's changed in the healthcare world, Deutsch's book changed adult neurology, period. Breast cancer awareness changed breast cancer treatment, period. And what happened was not just that parents or patients became empowered, which I strongly support, but the general public got upset. Because I always use this when I'm giving a talk, but I've got white hair and I'm old. And if I have a stroke, I expect to start treatment almost immediately, within a week of my stroke. My prognosis for change is good because I'm generally healthy and I used to be an athlete. But a baby with exactly the same brain damage is told that there's nothing to do. I got an email last week from a mother who was told at 6 months that her baby had no possible treatment for cerebral palsy. And it's just not accurate. But what can you do? So I wrote the book because if the parents become aware, and if the grandparents and the friends of the parents and everybody else becomes aware, then change will happen.
Let's finish up on this. Again, a quote from the book. Babies fall repeatedly as they practice gross motor skills, learning to stand and then walk. An older child learning to ride a bicycle is likely to pick up some bruises along the way. Too often, children with disabilities are protected when they should be allowed to fail in the course of learning a new skill. Our brains work best when there is a problem to solve. In which case, what advice do you have for parents whose children experience an early brain injury that could lead to cerebral palsy?
I think you have to raise the child as a child. You have to give them the same learning opportunities as anyone else. You may have to modify a few things, but to protect them, to wrap them up in gauze and cheer them on when they're not actually trying, they're not going to learn because neuroplasticity is triggered by novelty, challenge, and consequences. That's how we learn. And so we have to put kids in learning environments.
The boy who could run but not walk, understanding neuroplasticity in the child's brain. That's Dr. Karen Pape. Thanks so much for your visit here at TVO tonight.
Thank you.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.